seamlessly remembered to do that. Thank you, George. So I did want to welcome everyone to this TASA Thursday event, this session, and we have an excellent presentation. Whether people are watching this live or digesting it when they can later on. We have two great speakers today, and so the presentation will run for about 30 minutes, and then there'll be opportunities for people to ask questions afterwards. It might be a bit overkill. I was going to ask people to raise their hands, but I think we're an intimate enough group that we won't need that. If people could leave their microphones on mute for the time being and then unmute when we get to the question session, or you can put anything in the chat as well. If there's something as we're going along, you've got a burning question that you might forget, feel free to put it in the chat and we'll come back to that. I will skip to your next slide, as it was what I was going to say anyway, that before I introduce our esteemed speakers, I wanted to acknowledge the traditional owners of the lands on which we're meeting, and also acknowledge that TASA acknowledges the traditional owners and custodians of this land, and TASA recognises their continuing connection to land, waters and culture, and pays respects to elders past, present and emerging. I'm joining you from the Wurundjeri lands of the Kulin Nation. I'm going to add that these are unceded lands and that they always were and always will be Aboriginal lands. You're all most welcome to either acknowledge the lands you're coming from as you first speak, or feel free to put that in the chat. So on to the business of the presentation, we have our two speakers, and I'll paste their full bios into the chat because they're quite impressive. But just to introduce our two speakers for the day, Sharyn Roach Anleu is Matthew Flinders Distinguished Professor of Sociology and Dean of Research in the College of Humanities, Arts and Social Sciences at Flinders University in Adelaide, and a Fellow of the Australian Academy of Social Sciences. George Sarantoulias is a PhD candidate in the Literacy and Cultural Studies Graduate Research Program at Monash University, and also teaches sociology and social theory at Flinders. So I'll pass it over to Sharyn first, I believe, to get us underway, and I'll put it back on I'll go to the next slide. Is that okay? Or do you want to go back to the...
Oh, no, that's good. That's good.
Over to you.
Great. Thank you for your introduction, Kay, and for chairing the session. Thank you for everyone for coming along, and I'm joining you from the beautiful lands of the Kaurna people here in Adelaide. The way that George and I have structured the presentation is that I will speak to the first half and he'll speak to the second half, and then we'll come back and have a bit more time for discussion. So I'm going to aim to talk for about 15 minutes. And I want to do two things. So the first thing is to just think about and talk about how the project even came about, and then to talk about kind of what we've done in the project. So in terms of the project, it really started for me in 2020 when I noticed, when I walked out my office door, a proliferation of various signs that related to instructing people to do certain things and regulating mobility, instructions to wash hands, to maintain physical distance and so forth. They were on the notice boards, which were really the walls of the building. So I was in a building that the walls were actually notice boards. So there was scope for lots and a large proliferation of these signs. And it struck me that the signs were really a compression of very complex information that had been kind of almost melted down into simple directive statements. And it reminded me of an article that I read a long time ago by Hermer and Hunt called Official Graffiti, which describes the various signs and symbols as part of our everyday life, which have become almost naturalized. And then I had some conversations with George, and we're both teaching into the sociology of deviance, and we thought about the way in which the social norms and norms that we took for granted, especially in relation to interpersonal relations, mobility, activities, had changed as a consequence of the pandemic and government responses to the pandemic. And we thought, well, we can write an article about this. So we thought, yes, we'll write an article. And then I became aware of a workshop, a hybrid workshop that was being run at the National University of Singapore on a concept which is governing through contagion. So there are lots of kind of things that happened, and the outcome of that, which has happened to me a couple of times in my career, that as a consequence of a conversation with somebody, I think, we can write a paper on that, let's do it. And so part of the trajectory of this project is that it grew, which I think, looking back in hindsight, is a kind of really interesting a really interesting process, because it wasn't really planned and there wasn't a particular strategy. And on the other side, it was a lot of fun. It was a really interesting, fun project. Okay, so next slide. So that's just the proliferation of the signs, and then thinking about their role in the communication of new social norms. So a lot of our taken for granted social norms around interpersonal interaction, mobility, washing hands, face masks, and so on, were new and displacing social norms which we'd all taken for granted. And so the communication of these new social norms, an important way for that communication was through the visual and through various signs, which you would have all been very familiar with. And that they deviantized behaviour that had been unnoticeable almost, or expected, or certainly not norm-breaking behaviour, and instituted levels of social control. So I'm not talking here about the use of emergency powers, although that is a kind of big contextual set of issues that was used in terms of the criminalisation of activities. So I'm not talking about criminal justice system or the use of emergency powers, but rather the way in which these social norms became communicated through the visual. So next one. So the signs themselves, the signs, the posters, the information can be seen as objects, as things, as both two-dimensional and three-dimensional. And so for me, this was a new way of thinking about the communication of social norms. And I guess I forgot to mention that in my teaching of the sociology of deviance, I had set as an assignment students to locate signs and information and for them to describe the underpinning social norms. So that was already kind of that in the back of my mind as well. So there were lots of these instructions, signs, and posters of various kinds on buildings, inside buildings, on the doorways, shop fronts, windows, in many places throughout our cities and public locations. Now, the information communicated several kinds of things. On the one hand, it communicated public health information, washing hands, wearing a mask, sanitizing, and emphasized the importance of not spreading COVID. It also communicated regulation. People were meant to modify their behaviour, were meant to self-discipline or self-govern and change their behaviour to not be as physically close to people, not to cough and sneeze, and not to, and there's various levels of these social norms, because there was, you were only allowed to have a certain number of people in your homes, you were not allowed to travel, you were not allowed to congregate. It varied in different cities as well. And these are underwritten by medical and legal authority, so that the signs and the activities kind of became camouflaged and normalized, almost naturalized. And I'll get to a slide in a little while that shows how they've kind of just camouflaged among a whole variety of other signs. So as I've mentioned, next slide, the signs were pervasive in buildings, public transport, streetscapes, and were an example of what Herman and Hunt defined as official graffiti. And official graffiti reduces rules and laws to a lexicon of familiar and interchangeable icons. Herman and Hunt describe this as defacing public spaces. And the public spaces and the norms are meant to shape the interaction order. And that's a concept that comes from Goffman. So the regulatory form that it takes affects and shapes and constrains our daily routines. There are questions of enforcement, and typically in the enforcement is around self-regulation or self-governance. And that is an empirical question, the relationship between the information and social control or changed behaviour, modified behaviour. But it is one thread in the complex fabric of governing through contagion. And there are, of course, empirical questions about the extent to which governing through contagion is successful. And George is going to talk about this idea of governing through contagion in a moment. Okay, so now I'm getting to the research. So next slide. So what we did in the research is George and I both photographed a variety of images of these signs that we noticed as part of our ordinary everyday activities. I was located in Adelaide and George located in Melbourne. And so we took these images, these photographs in 2020, between July and August, and we talked about which ones to include. And these, the ones that I'm going to talk to now, are in our paper that was published in JOS. So the first one I'm going to spend a little bit more time on, and then I'm going to zip through because I think I've only got 5 minutes left. Okay, so this sign, which was located at the opening of a city market, has an enormous amount of information summarized and boiled down into this very direct set of instructions. So it relies on legal authority. There's the crest of the Australian government. It suggests that this is a national issue, not a local or a state-based issue. We can't assume that the source of the directive is significant or the only significant thing for legitimacy. The way in which instructions or norms are communicated is also important for compliance. There's very directive language. There's you must stay, so it's very directive. And the way in which it's set up suggests questions. It anticipates questions. You know, what about here? What about there? So it emphasizes even in the aisles, even in the queue, yes, you must stay 1.5 meters apart. The sign uses words and symbols. It appeals to the collective. So there's moral legitimacy. Our market, something collective, is not just about the individual, it's about a collective. And it closes with thank you. So there's a sense of a courteousness. So not just a legal imperative, not just a medical imperative, but a collective imperative as well. Now, the next two slides show the way in which these normative statements have become fused with the physical environment. So the next slide is quite different from the first one, and there's no text and the simple use of duct tape to convey that people must remain 1.5 meters apart. And the next one is also a a sticker on the footpath which does not mention COVID, but emphasises social distancing. There's no mention of legal or medical authority in this sticker, but it's an appeal to the collective. Together we can help stop the spread. Another angle that we've looked at, next slide, is to whom is the sign directed? Does a poster or information instructions differ depending on the audience or the anticipated audience? And this example comes from a skate park where there's no mention of coronavirus. It starts very boldly, eye-catching heading, no government crest, no indication about health information up front. But it makes a very interesting comment to look after yourself. So perhaps not so much an appeal to the collective and then others, and an emphasis that the rules apply here and everywhere. And we wondered whether that's because it's a skate park and an expectation that people may be less likely to take these kinds of rules seriously. Another kind of sign that we discuss in the article is the use of traffic signs, or the LED signs that are typically used in traffic management. Next slide. And this involved a continuous loop of 5 flashes. And in this one of 5 flashes, it's very directive. There is not much information at all, but the assumption that people will know what's being referred to. There's the strong moral imperative to protect, which suggests danger and harm. There's no mention of coronavirus, but a mention of the community. Now, I mentioned at the outset the idea of camouflage of the different signs, and the next sign comes from a university corridor, which shows the way in which these signs almost become unnoticeable or naturalized or normalized as part of the array of posters and signage that is around various kinds of buildings, and in this in particular is a university example. So there's a mix of posters that were attached, and this was outside my office door, and so this is where I started to think, well, you know, this is a really interesting phenomenon. Okay, now I'm going to so this was the Joss paper, and now I'm going to hand over to George, who's going to talk about some dimensions of the theory, but also the next steps this little project took.
Thank you so much, Sharyn. And I'm also speaking from Wurundjeri country, from the Kulin Nation. So I also want to acknowledge that these lands were never ceded. My goal with this part of the presentation is to explore a little bit further in the theoretical frameworks that we employed in our research. So just as a bit of introduction, and I apologize about the possible overlap with what Sharon's already said. Our research approached the phenomenon of the pandemic's management and containment from a sociological, social-legal lens by employing 2 main sociological concerns: social control and regulation, and visual research. So we aim to understand how the interaction order has been reconfigured, making previously acceptable behavior deviant. Social control, as most sociologists would really understand, can be viewed from 2 perspectives. The functionalist thinkers see it as an essential for social life, benefiting the collective and making social interaction possible. And conversely, conflict theorists, influenced by the Marxist or Foucauldian perspectives, perceive social control as a tool for managing population, benefiting elites and the economy while disadvantaging others. We, in this paper, argue that social control mechanisms can simultaneously enhance collective well-being and promote rationality, discipline, and governance. And this, rooted in the kind of Weberian thesis on modernity, governance involves a continual interaction between legal and other forms of power, aiming for a regulated freedom, self-governance, and self-discipline. Sanctions were imposed on individuals who failed to conform to new regulations. And our focus was on how the instructions and information about new social norms was conveyed to the public. And we collected this research data through the photos, which, as Sharyn said, was in fact quite fun to do. I found myself taking photos continuously. I had so many photos. There were so many signs that we had to choose from for our analysis. But the two frameworks that we employed were the governing through contagion, as discussed by Chua and Lee, which highlights how governance adapted to control contagion through legal and social regulations. And our article examined how rules and regulations managed public behavior during the pandemic, emphasizing, in fact, the role of imagery and signage. In addition to that, the second theoretical framework we employed was Charles Taylor's concept of social imaginaries to understand how communities collectively envisioned their social life and norms, shaping behavior and expectations during the pandemic. Next slide, please. And now I wanted to look at the concept of governing through contagion a little bit more productively. And it's essentially involves this implementation of rules, regulations, and instructions to control a virus's spread. And we focused on the sources of legitimacy behind these rules and their communication across various settings. So complex information was compressed into simple, understandable formats using imagery and signs, ensuring that essential health guidelines were easily accessible, and self-discipline and enforcement were crucial in ensuring compliance. And this reflects the disciplinary and security modalities of power within the GTC, governing through contagion framework, which I will expand on in the next slide. So the GTC framework integrates three interlocking modalities of power: the juridical, the disciplinary, and security. The juridical modality refers to legal aspects and formal regulations such as lockdowns, orders, and mask mandates, while the disciplinary modality focuses on routines, norms, and social practices that discipline individuals, including frequent hand washing and social distancing. The third modality, the security modality, encompasses measures taken to ensure safety and manage risks, such as surveillance and monitoring. While together, these modalities created a comprehensive approach to governance during the pandemic. Next slide, please. The second framework, coming from Taylor's social imaginaries, helped us understand how societies imagine their collective existence through shared expectations and normative notions that underpin social interactions. In our article, we also made this kind of connection to the interaction order and Goffman's work. But our article explored how these imaginaries influence public perceptions and acceptance of new health norms during the pandemic. This framework was crucial for examining how new social norms and behaviors were adopted, as the collective imagination of a safe and healthy society drove individuals to accept and adhere to the new regulations. Understanding these social imaginaries allowed us to see how social expectations were reshaped in response to the crisis, facilitating widespread behavioral changes. Next slide, please. So the fun didn't finish with our first article. We were lucky to also present at the conference that was basically on the governance through contagion, and we contributed finally a book chapter, instruction, information, images, and icons governing contagion, social regulation, and public health, in a book edited by Chua and Lee. which explored visual communication and public health governance, but focused a little bit more on mask wearing, because we saw a concrete difference in the first images that we analyzed, and the second images, the second row of images were more about the instructions about how to wear masks, indicating that people were trying to wear masks but not doing so correctly. And I remind you of people that would wear their masks, let's say, under their noses. So we found that very interesting. Next slide, please. So just a little bit more on the second chapter that or the second paper that we was that we focused on the mechanisms used to communicate these norms, especially mask wearing in this case. And our chapter examined the critical role of visual imagery in conveying public health information and regulating behavior. The pandemic disrupted everyday social interactions, and as we said earlier, generated new norms such as physical distancing and other mask wearing, etc. But visual aids like posters and signs compress the complex public health information into accessible formats. In this specific paper, we investigated the normative messages conveyed and their impact on public behavior. Visual imagery proved essential in governing through contagion and is one of the weapons in the panoply of governance through contagion implementation, which highlights the interplay between visual communication, legal authority, as well as social imaginaries. I just wanted to show the next slide, which were some of the pictures that we used for the second paper. And we noticed also that some of these signs were no longer just on paper. The sign on the right is actually situated in Clayton, and it's still there today, showing the enduring changes that COVID-19 has brought about. Just to move on to the next slide. This is a work in progress, and in fact, we welcome any comments and any feedback that you might have to assist us on our way, because the path is not exactly clear. But we were looking at how translating public health instructions into effective visuals for multicultural societies involves an understanding of diverse audiences, and it accounts for cultural nuances. This work in progress aims to explore how these challenges and the role of community engagement highlights the involvement of community leaders in disseminating health information. And in this paper, we're going to be moving beyond the social imaginaries of governing through contagion frameworks that we've been using. They won't be as central. And we're thinking of turning to Bourdieu, possibly using the concepts of habitus, field, capital, and legitimate language to understand how different social groups perceive and respond to public health instructions. Of course, Bourdieu argues that legitimate language is the language spoken by those in power, officially recognized and valued within a social context, and standardized through educational systems, legal frameworks, and other institutional mechanisms. So analyzing the choice of language in public health messages can help us understand how authority and legitimacy are conveyed and perceived. The second theoretical framework we're going to be employing comes from Wendy Griswold's methodological framework for the sociology of culture. And it focuses on intention, reception, comprehension, and explanation, which would allow us to analyze how public health signs and instructions are crafted, received, and understood within multicultural contexts. Insights from a comparative study of signs in Athens and London would be integrated, and examining the directness of language, the type of relationship signaled by the signs, the cooperative genre of speech employed, and the emotions conveyed or suggested, such as loyalty and trust. But I think combining Bourdieu and Griswold, their approaches with additional insights will provide a concrete analysis of how public health messages are interpreted across different cultural contexts. And from here, I would like to just see the next slide for the images that we're going to be possibly using for our third paper. And these were all taken at Greek Orthodox churches during the time of the pandemic. So yeah, that was kind of the aspect that we were trying to go for. But yeah, I'll turn it over to Sharyn for the concluding remarks.
Oh, you're on mute. Sorry, Sharyn. I have to start all of that again.
Yeah, I think that's the most frequently stated phrase in the modern era, isn't it? Okay, so I want to make just a few concluding comments about the substantive dimensions of the research, and then to think about the collaboration a little bit. Okay, so across the three pieces of work or outputs that George and I have been involved in, clearly our focus has been on the way in which signs and posters mix icons, numbers, and words and make simultaneously assumptions about the audience, the viewer, the reader, the consumer of the sign at the same time as communicating new social norms. And an important part of that is the nature of the social control. Often they did not mention, any of the signs mention penalties, consequences, except in a kind of general moral way, you know, to keep the implication is if you don't protect the community, keep the community safe, it will become unsafe. And so that is detrimental. So there was no mention of enforcement, police, crime, criminal justice. It was operating at a very different level and kind of a social control, although of course not incompatible with the broader legal framework and criminal justice penalties that were implemented in some jurisdictions quite rigorously. Also, the signs, interestingly, drew on several sources of legitimacy. So there was legal or governmental legitimacy, as well as medical legitimacy. This is important for everybody's health to stop the spread of a virus, so a medical or biological concept. But also an appeal to moral legitimacy. This is the right thing to do. This is the correct thing to do. This is important, not for you just as a rational, self-interested individual, but important for the collective. And that's one thing that we really didn't have time to draw out today, but I think that was a really interesting tension between the individual and the collective that came through in our research, at least. So really what we've presented is the biography of a project that came about through serendipity. And so I'd invite everyone to be open to the idea of serendipity, that sometimes you can be in a situation and you think, we could do that, we can do that. And sometimes without being particularly strategic or instrumental, things can grow and they become bigger and they take you down a path. And depending on the context in which we're all working around, you know, needing to have more Q1 publications, grant income, etc., you know, you have to balance interesting pieces of research which are maybe a bit of a frolic with some other big issues. But I think through this project, which was fun, and I'll stop doing it when it's no longer fun, but it was fun. It really did bring out some quite fundamental sociological concepts and ideas. You know, we can talk about, but I think it's kind of really interesting to reflect on how a collaboration works. I mean, we're all supposed to collaborate now in this research environment that we operate in within universities. So it's a good thing. Collaboration is seen as important and good, but they don't necessarily work. And so I think it's quite interesting to think on, you know, what are the elements for a successful collaboration? And as I've said, the project kind of grew, and I guess because we kept nourishing it and finding more things to talk about and more things to think about. So I might just kind of leave it there. Obviously, each of our slides, we could have gone in different directions and gone down more rabbit holes, but perhaps at this point there's enough if people got questions or want more elaboration.
Thank you.
Thank you.
Both. I found that really amazing. I'm going to stop sharing so that we can all eyeball each other.
Although, just as you've stopped sharing, I just do want to say that the next slide was an acknowledgement slide. So we do need to acknowledge a little bit of funding that came from Flinders, not very much, and acknowledge that some of the ideas from the presentation have been presented. Oh, you don't need to get it up again, Kay, don't worry. Some of the ideas have been presented at other events such as the TASA conference and the ISA conference. And we appreciate all the feedback and comments and input that we've received over the course of this, of the biography of this project.
And I'll just leave this slide up long enough for people to take it all in, because these are the important social practices of our discipline and how collaborations are successful in acknowledging all the different people that have gone into it, where it's gone. So I think that's very important to put up. I'll ask people to either put their questions in the chat or to put your hand up, or just turn your camera back on is always how we can tell if a student ever wants to say anything. Great. Michelle has a question, and
no, I don't have a question. I just went, this is the conversational part, so I'm signaling communication readiness. And yeah, thank you. Such an interesting topic, and really, I love those things that you just come across that go, yeah, this really gels with what I saw during the pandemic. So it's really awesome to see that theorized and brought out, and I totally just downloaded one of the papers to read and send around to friends. So thank you, it's really interesting.
Oh, thank you, Michelle. That's a lovely comment. Thank you.
I think what you said about finding the fun in academia, we have all of these impositions on us, but often these fun projects that just come about because it'd be fun turn into much more than that and become the serious body of our work and these serendipitous conversations. And I have a feeling that this presentation may lead to a lot more of them. And so I can't see this project ending anytime soon, because as you were saying, every one of those slides is a whole other research project on its own. And the intersections, I was going to suggest, here at Swinburne, we work quite closely with our design school, and we have communication design, people that would call themselves design sociologists. And there's a couple of students who I know would love all of this. And so while other people think of questions, I was really taken by the sign at the skate park. And for one, I love the idea that you were at a skate park, Sharyn, and I hope you sort of...
Oh, I have to say, that was George. Oh, that was George. Yeah.
I'm unapologetically rollerblader. So I frequent at skate parks.
How did you get out?
I used to as a parent, and I always thought at the time they would be great places to do social research. Anyway, I'm distracting you, Kay. Keep going.
Well, I was struck by that sign, how it talked quite differently to its audience, and whether that was a one-off example or whether you saw either at university campuses where there it was these a deviant sort of cohort to begin with of these mischievous, meddling kids at the skate park, and whether you saw that anywhere else, and other than the multicultural lens you've taken, whether there's different audiences that are assumed to be problem populations.
I can have a go, but George, you've no doubt got some other comments. Okay, so this started from the ground up, and I think, and in a way, the moment's gone because those posters no longer exist in many instances, or so some have been retained, and it kind of, and so we didn't try. I mean, you're asking a methodological question and a research design question, actually. So we started from the ground up and kind of iteratively found things that were of interest, and then selected a variety. I think we have 5 or 6 in the paper to talk about within the scope of our 8,000 word paper for JOS. Now, in my travels, and again, you might say, well, okay, Sharyn, you're only moving around certain parts of the city. You're not moving around all parts of the city.
If you're in Melbourne, it was a very constrained part of the city.
Right. The sign was in one of the Adelaide suburbs. So you say, well, actually, it's not representative in any way. You haven't kind of done a full scoping. It is not representative of the range of signs that existed. But with all of those caveats, nothing else jumped out at me with the same kind of, can I use the word tone? I don't know whether with the same kind of tone. And also, perhaps it's fair to say that the suburb in which it was located is one of the outer suburbs, which, you know, you will kind of have an image of outer suburbs that exist in Australian, in and around Australian cities. So it just was really striking. I think that's what caught your attention, George, but you can talk about that a little bit more, about why this one caught your attention.
Well, I mean, I think Kay really kind of understood where I was coming from, because skaters are already a group of individuals that are perceived as deviating from the norm. They want to grind on things that are not meant to be grinded on. They want to be doing things that you know, we look at this, we look at infrastructure in a different way. I mean, I walk around and for me it's kind of like a playground. What can I do here and what can I do there? And skate parks are this kind of like spot for contained deviance, so to speak. So when I saw that, you know, rules apply here and everywhere, I was like, this is directly talking to skaters and the public perception of the skaters, and basically labeling them as deviant.
Yeah, I think there's a paper in just that sign.
Yeah. Although I gotta say, I saw something similar in Greek churches.
Hey,
where
you feeling particularly targeted, George? Because that's like you're a rollerblader.
Yeah, I know. So basically, there was a lot of like kind of do not kiss the icons, and there was this clash between you know, religious legitimacy and creed, and then governmental kind of regulations. So there was this clash between, should I believe in God and I should be kissing the icon, or should I believe that this you know, the virus can be transmitted?
Did those signs contain that sort of, we know you're going to disobey the rules, and
in a way,
even though you're going to
break the icons, but in Greek, they were all in Greek. So, and they were also they were made specifically. It wasn't kind of it was written on paper.
So this is paper number 3. This is paper number 3 that we're working through. But you're right. Any one of the images could become a paper in itself, which to me is really an interesting turn for sociology. It's much more a kind of arts and humanities kind of research design.
Yeah, the graphic designers, I think, will, like with that semiotic kind of analysis, will be maybe having a conversation with one of them. But Neville has his hand up. Over to you.
Yes, can you hear me?
Yes.
Yeah.
Okay. Look, first I got to apologise because I had problems connecting through the Zoom. So I missed most of it. but I will try and go back to the recorded session and have a closer listen.
And you can read the article as well, because it's based off our article. Yeah.
But you did make a comment, Sharyn, which I want to explore if I could. And you said that some collaborations don't work. So my question is, in relation to that statement, with researchers in the community that are not employed by the universities, in terms of their expertise in the areas that you're exploring, for example, George mentioned the Greek Orthodox and made a very glib statement, or someone who's an expert in studies of religion, that there was a conflict between belief in God and kissing the relic. I would not know any Greek Orthodox theologian who's worth their salt that would argue that. That's pretty glib.
Okay, so perhaps I should pick up on the collaboration issue. And I mean, I guess the point that I was trying to make is that we're all supposed to collaborate. And when you force people or ask people to work together who may come from different understandings of their relationship, maybe in different power positions in the university, and arguably one could say, well, I'm a professor and George is a PhD student, and there's a very unequal power relationship there. I have been very conscious of that, and I have tried to ensure that we're equal partners in the research. So the first two papers I have led. The third paper, George is going to lead. So I see that as a kind of perhaps a mentoring process, and then George will take the lead. I think it's appropriate for George to take the lead. I think I perhaps take your point that when we do prepare a paper, that it will be a lot more nuanced than in the context of a comment on a Zoom presentation that's very time bound. But that we will look at the images, particularly in their context and in relation to the anticipated audience, and looking at some assumptions, because all the posters and instructions make assumptions about the nature of the audience. And so that we will try to dig into a little bit more carefully in the context of the particular Greek Orthodox setting. I mean, I was really struck, not being Greek Orthodox myself, by the putting together of the religious icons and the icons as part of these posters. It just seemed to be a kind of really interesting space that was ripe for sociological imagination.
Yes,
perhaps I'll leave it there.
Yes, no, that's good.
Can I please also add?
Yes.
Thank you, Neville, for your comment. I think maybe maybe I didn't come off as kind of try to explain what I wanted to say. My whole point was that I noticed in these churches, which I go to as a Greek Orthodox person, that there were images and signs saying to people, don't kiss the icons, assuming that they would. Also, the communion was kind of banned, right?
Yes.
But communion was still going on behind closed doors,
right?
Which was, deviating from the norms of what the government wanted. And I think in Melbourne we saw a number of different groups of religious groups of people congregating. There was even on the news, I think there was some Jewish groups that were congregating, and but yeah, this was just my experience, and just seeing these kind of signs that were basically just printed out, a Microsoft Word document, and writing down, please don't kiss the icons, because they were assuming that they would.
Yeah, so status of affairs, philosophical status of affairs, you're right. So I don't disagree. But my writing is getting ignored in terms of cognition histories amongst belief groups, the religious and the secular. So there's a huge amount of philosophical, sociological misunderstanding from the researchers. And
I'd love to read your work then, Neville. I would love to include it into and help me. I mean,
Sure.
you know, knowledge is such a collaborative process, and we have to be reading everybody's work.
That's right. I agree. And I have a very strong argument about multidisciplinary education. This is you know, we've ignored the criticisms in sociology of education about academic specialization and how it misdirects the direction of research because it is not built within a larger scoping.
I see.
I have a feeling this might be another Thursday session.
Yeah,
We'll see
that's
where
great. Yeah, no, there's lots of big issues there, which is really important to reflect on.
Luckily, we have you on the recording saying this, so we know where to come. Like, now, over to Michelle.
Oh yes, I have a question. I guess I was interested. I wanted to say first, I loved your reflections on collaboration, and as a sociologist who's ended up in legal sociology and sociology of law, that's been a kind of continual reflection. I think it ties into your kind of generalist versus specialist point there too, that it can be helpful to be a sociologist in some very specific fields. And I'm currently a research fellow with a bunch of at an aphasia research centre, and just about everyone who works there is a speech pathologist. And I think the communication in simplified communication, symbolic communication in complex information to people with communication disabilities. I think that there's some interesting stuff there because the COVID related documents that were produced for people with disabilities, for example, and how that intersects with speech pathology, because they're often specifically designing communication for people with communication support needs. And I guess because I work at a hospital, I mean, I don't work at a hospital. My office is in a hospital. There is still a lot of COVID messaging in hospitals. And I thought, just as a collaborative comment, it might be interesting to look at spaces where COVID messaging is still present, because I feel like it's expired in a lot of other community spaces. But in the hospital, for example, we still have purpose billboards that are out. We often have sort of semi-lockdown periods when COVID is, like, we had one relatively recently in this year, where it was like, oh, if you can work from home and you're not, then work from home because COVID is spreading. And it's been quite interesting to be in a group of people where that messaging is still so prominent. And I guess I don't know that there's a question in there, but something maybe around the spaces where that's still going on and how that contributes to your analysis of what was happening when you were taking those photos. Oh, look, that was just a big collaborative ramble. I'm going to write that off as, sorry.
I think that's a terrific idea because, you know, as I read through our paper again, I've realized that the public life, when, you know, as I'm moving around, has changed. All of a sudden, those posters have gone. And so it's really interesting to think about the residues. And you've reminded me that when I go to the dentist, there's still a protocol around COVID. And there's still people who wear masks sometimes, but not all the time. You know, if you travel on a plane, there'll be a few people with a mask, but not many. So I think the idea of residues is, and that's not the language that you've used, but I think that's kind of a really interesting idea.
it's where
This has also reminded
I
me.
did. Oh, sorry, George. I was just going to
Okay,
say
Michelle.
we did some data collection in an aged care facility in Chinchilla and had to do COVID tests. And I hadn't done a COVID test other than if I thought I had COVID for like a year. And it was really, and again, a lot of signs. You had to stay outside the facility, do the COVID test. And it was really interesting in that kind of spaces where regulation is more acceptable around health, whereas where it's not acceptable, where it was only the kind of freakish nature, the aberrant nature of the pandemic that allowed that regulation to kind of spread into those spaces, but then it's endured in spaces where that regulation is more acceptable. There you go. That I did have
Michelle, you took it out of my mouth.
Sorry, George, I totally interrupted you.
I'm so grateful that you did that, because I recently went to an aged care facility called Frodida, and they were testing stations outside. And I felt the same way. I was kind of like, oh, do I really have to take a test? But yeah, it was there, and there was a lot of, because Frodida is predominantly it's a Greek center, so there were a lot of signs that my eye went to thinking about this paper. But it's
and how quickly that's happened.
Suggestion, I think,
is really
yeah.
Sorry, I think that's it speaks to that regulatory function that you were talking about, and where that's still, how it became acceptable and how it so quickly became like graffiti. It became able to be ignored with impunity in some spaces and not others. So interesting.
Before we go to our final questions, we're right on 1:30. It also speaks to the octopus nature of this project now, where this could be a whole new project, the tie-ins, like taking it down through that religious, philosophical, like that each project becomes more projects. It's a never-ending series.
That's right.
Our last question, Saeed.
Hello. From here, from Malaysia, good morning to everyone now. Actually, I am working in University of Malaysia Sabah Sociology and Social Anthropology program. So it is a beautiful presentation and beautiful work by Professor Sharyn and George. Really appreciate it. And also comments from the audience, other professor comments, right? So I have a question, I have not a question, but I want to share with Professor Sharyn and George that when we use the maintain social distance, right? During our pandemic years, the power of social. So how is it, you think the majority people take it positively or negatively? I mean, what is the situation when you use the social distancing? I mean, social is related to many interactions, welfare of the society, welfare of the neighborhoods. So when we overuse, is it overuse that maintains social distancing? How this word, word is perceived by the community, the people, or take advantage by this promotion that people are distancing from each other's, interacting from each other's. I really feel that, I think, what is your thought on that, both of you? Yeah.
First of all, we actually referred to this, Sharyn. If you remember, we had a footnote on this, that social distancing is really about just physical distancing. Did you want to elaborate a little bit more on that, Sharyn?
Well, no, you can, and I can add. So I think, you go ahead, George.
So essentially, it says that we're social distancing, but it's kind of a loaded concept, and really, it's about physical distancing, not the distancing of community.
Yeah, but it is. I think it's a really interesting question where the concept came from, and it's triggered a memory in me from way back when the professor of sociology, when I was an undergraduate, told me I was good at social distancing. Now, I don't know, looking back, what that actually means, but I think it meant that I knew how to draw the line between the personal and the professional. But I've just thought about that then, because, you know, you're right, Syed. This concept, it hadn't been used. I don't know where it came from. And all of a sudden, it was everywhere. And there was quite a bit of pushback, as George mentioned, that people said, and I guess we haven't talked really about the impact of Zoom and the way in which entities like TASA used Zoom meetings to maintain social integration and social connectivity. So people would say, well, yes, while we're not physically in the same space, there's still social interaction occurring, and Zoom became a very important way. And I noticed that these TASA Thursdays are the residue of TASA's implementation of creating more opportunities for social connection in a context where there was a lot of physical distancing. So I think it's a terrific question. Thank you.
Yeah, thank you, Prof. Yeah. So I feel, I mean, that people take it over related to other things, not only physical distancing. Some people are even, the kids say hi, their sign is different. They're scared of something. You understand? Even say hi, they're scared of something. So there are many things happening between these people distancing from other things. Whatever you say, that deviating from other things, you know, alienated from other things, not only the 2 meters distance, right? So yeah, I was thinking that you are the great professor. So the power of social distancing, how we can do this one to, you know, maintain the things exactly. Okay, thank you so much for your.
Said, I think it's very interesting, and I saw certain signs that with regards to masks, and some of the signs said we're smiling underneath these masks.
Very good.
Because the masks kind of stop the interaction and created that distance.
I mean, social people conceptualize many things. Not only physical. He said hi, they stop anything. They stop anything to do. So now it's not yet over again. Maybe, I don't know, the world will face. But thank you for taking your time to reply this. Thank you.
This conversation could go on for a very long time. And yes, I think everyone will have to leave. But thank you so much, Sharyn and George. And I'm going to add a very cheeky comment in the end, that maybe the use of social distancing and not physical distancing in Australia is an attack on the social sciences by the Morrison government. But just to be very cheeky of like pushing the social under the bus at every opportunity.
Yeah.
Glad that's on camera. But thank you, everybody. These are conversations we can pick up, hopefully, like in person at some point. Like people are at conferences or at some of the little workshops that go on, at thematic groups. Hopefully there's a way for these to seed new research. I think everyone here is thinking about at least 2 or 3 projects that now could start from this. And it's I think, George, you were saying before that like all of this information and all of this research just builds this web for us to like extend upon. This has been great. So thank you everybody for coming and for contributing and for listening, and it's been great, and hopefully I'll see you all sometime again soon.
Yeah, we
Thank
love
you for
to
having us.
Thank you, Kate, and thank you everyone for coming along and being involved in the discussion. It's been great. Thank you.
Thanks, everyone.
Bye-bye.